Well, good afternoon. It's a pleasure to join you in this capacity, although I've had the great honor of being part of the whole session thus far, and am very moved and excited by the work and conversation that's been going on. It's my honor to lead a discussion with all of you on the impact of urbanization on health and global health for populations. And when I invite Commissioner Farley to join me in a few minutes to consider the ways in which New York is leading as a city in defining the lens through which to create the health of populations in cities and to create healthy cities. Before I make some comments, I want to say that I'm going to give a little introduction, and then Dr. Farley and I are going to have a discussion, but you all, as the audience, get to text in your questions. And there is I can't see it, on my right is the instruction for how to do that. So while you're noting that down, let me start by saying that what all of you know is that at the same time that we are dealing collectively all over the world with long-standing and critical challenges to health and the well-being and development and productivity of countries all over the world as they're developing, the world is changing simultaneously, and there are profound changes which are reshaping the nature of long-standing health challenges and creating new ones. Life expectancy has changed. We heard this morning from Gary Cohn about the fact that 20 years ago in many countries like Ghana, when life expectancy was 40, the introduction of the tremendous interventions that so many of you are leading has led young people now to be able to look forward to long lives. And as young people are growing up in young countries, they are going to grow old in old societies that have benefited from those longer lives. At the same time, we have new health threats being added on top of old, particularly the epidemic of what we call non-communicable diseases, although the terminology is arguable, is of great concern. Third, urbanization. For the first time in human history, most of the world's population is now living in cities, while occupying less than 2% of the Earth's surface. And many of our preconceptions are changing. Africa is often considered to be predominantly rural, but its urban population is now larger than that of North America. By 2010, there were 2.5 billion urban dwellers in low and middle income populations, roughly the same as the world's total population in 1950. Most of the world's largest cities are in low and middle income nations, and this is unprecedented historically, as most large cities have previously been in the wealthiest nations. And then sustainability. Urban areas create 60 to 80% of the global energy consumption and about 75% of the carbon dioxide emissions. What do these issues have in common, aside from the fact that these are changes that are rapidly emerging? They all require us to be addressing them collectively and in concert. They all have to be solved with advanced and intentional planning and approaches. I would argue that they all benefit from a public health lens and from using increasingly cities as the unit of analysis, because urban shapes health. The urban environment shapes the food we eat, the water we drink, the air we breathe, the amount of exercise we get, and the schools our children go to. Our school and many other schools of public health are providing the science that shows, for example, that the particulate matter in air pollution, ranging from coal dust to polycystic aromatic hydrocarbons as in that particular matter, have dramatic effects on health, ranging from chronic diseases like asthma in children to neurocognitive development in children to actually creating risk for obesity in children. So the environment in which our young people are growing up is shaping their long-term and future health. Urbanization has helped to decrease absolute poverty, but the number of people classified as urban poor is on the rise. From 1993 to 2002, 50 million poor were added to urban areas, while the number of rural poor decreased by 150 million. The greater share of the world's populations who live in lower income cities means that health outcomes of people at the bottom of the socioeconomic spectrum in cities may be of great import in the health of cities. And within cities, health inequities are starkly apparent. Urban growth brings out those inequities. It also puts pressure on the local environment, which further can disproportionately disadvantaged people who are the ones to predominantly live in slums and in precarious situations geographically. Witness the vulnerable locations by rivers and drainage systems and flooding and mudslides in Sao Paulo, Istanbul, Mumbai, New Orleans, and Jakarta in recent times. Conversely, healthy urban environments make for healthy people, and there can be no population health in the world we're emerging into without healthy cities. Health in cities comes from the built environment, the physical environment, the services and access to services, and the social use that's made of the environment, as well as the community norms and practices that affect lifestyles and access to resources and the necessities of life. Chronic diseases, the spread of infectious diseases, mental health, injury, violence, they're all modified by the urban context. And how we design and plan for cities of the future will bring out the huge opportunity, actually, for shaping health that matters to all of us. It certainly matters to corporations and the health of workers. I'll give you several examples about health in cities. First, let's start with one of the MDGs, although we could give salient examples of each of the health MDGs and how they're modified by urban context. HIV prevalence is higher in urban compared to rural areas. In sub-Saharan Africa, it's 4 to 10 times higher. This is thought secondary to social and sexual interactions, both of which are much greater in cities, also later marriage in urban populations, and higher risk of behaviors like IV drug use and commercial sex work. And perhaps it's also influenced by the higher prevalence of sexually transmitted infections. Infectious diseases spread more quickly and more profoundly in dense urban populations. Think of the epidemic dengue fever worldwide, which has increased sixfold in the past 40 years, particularly in countries like India and Indonesia. Urbanization is the key driver of this increase. Mental health. In New York City, people living in neighborhoods where buildings are marred by graffiti had twice the risk of developing depression over a 2-year period compared to comparable city residents living in neighborhoods with unmarred buildings. Think of asthma. In China, the prevalence of asthma in children has doubled over the past decade. Urban outdoor air pollutants, particularly sulfur dioxide and nitrous oxide, are associated with asthma in Chinese cities and likely account for some of the increased prevalence. Think of the aging of the population. How we design our cities completely affects whether the increasing population of older people can get out, can get where they need to go, can be engaged, active, and safe. There's evidence that taking a public health lens on these problems is the most effective approach to creating the health of populations, to investing in prevention, to planning proactively, to do what New York City has done so effectively, to make healthy conditions the default option and to shape the conditions in which it is possible for people to take effective responsibility for their health. So urban will increasingly, as we move to a world where 75% of the world's population is in cities in just 2 decades, urban is increasingly the unit of analysis and the context in which we create health. And I would argue that cities have to be considered increasingly as a unit of our world's public health system, a unit of a health system. If we think of universal access to health, investing in healthy cities of the future and public health systems of cities has to be a major component of accomplishing the healthy populations we seek. The frame for this, following on a frame that the World Health Organization is arguing for, is to recognize that there is a tremendous convergence between the interventions we need to make people healthy and the solutions we need to make our environment sustainable. The intersection where we find huge benefit is investing in interventions that do both simultaneously for the same price. And I would add that if we recognize the demographic shifts we're going through, which is our lengthening lives, which is fabulous success, that if we design for old and young in mind in that context of health and sustainability, we'll have urban environments for 80% of the world's population, which are great for all of us and sustainable. So with that background, I am thrilled to welcome Commissioner Thomas Farley. Commissioner Farley is the Commissioner of the New York City Department of Health and Mental Hygiene. He is the author of a really fabulous book, which I've actually given to all the faculty of my 500 faculty school, entitled Prescription for a Healthy Nation. Tom, will you join us? So Commissioner Farley, welcome.
Thank you.
I'm thrilled to be on the same podium with you. I'm a tremendous admirer, not just of your book, but of your leadership in New York over the last 4 years. Today we have the opportunity to think about the urban context from your leadership platform and view and experience, where New York has really been leading on tackling how we create maximal health for the population of New York City. So I'd like you to start recognizing that this is a global meeting to help us understand how what New York City tackles in terms of health problems are the key issues that could inform our thinking in cities all over the world.
Yeah, thank you. We know in cities in Africa right now, probably much of what people are thinking of in public health has to do with HIV and infectious diseases. But the world is changing very rapidly, and as those cities develop economically, their health profile is going to be similar to what we have in New York City. It's already happened in middle-income countries. It's very rapidly happening in Africa. Obesity rates, for example, are rising in developing countries around the world. And so everyone is going to be coming up around this issue of how do we deal with heart disease and cancer and other chronic problems and injuries as leading causes of death. And those can be very taxing to a healthcare system. They can be extremely expensive. But they also provide opportunities for prevention through focusing on behaviors and exposures which increase the risk of those. And that's what we've been doing here, trying to identify those behaviors and exposures which have the greatest impact on mortality and morbidity, and trying to create a context for having those behaviors and exposures be less common. And we feel we've succeeded in that.
So New York City in particular, but cities in general, are the places where the public health pyramid was discovered and created, starting with safe water, sanitation, safe food, healthy food, our environment, occupational health, and now to the prevention not just of the spread of infectious diseases, but not what we call non-communicable diseases. I wonder if you could provide us with a few examples of the kinds of public health frame that you've taken to making New York City a city that fosters health, and a few examples of what you think is effective.
Well, we've tried to tally up the preventable mortality in New York City, not by the diseases that kill people, but actually by the underlying behaviors and exposures. By that ranking, the #1 public health problem in New York City is smoking. And so that's why my predecessor, Tom Frieden, took that on as his #1 challenge when he came in as health commissioner. And so we put in place a smoke-free air law that was the most extensive in the country at the time, which has now been copied around the world. So prevent smoking in all indoor workplaces, including restaurants and bars. There were big increases in cigarette taxes because cigarettes follow economic principles like anything else. And they used mass media to get messages out about the risks of smoking. And that combination reduced smoking rates, which had been at 21% in New York City for about a decade, down to now we're at 14%. That's 450,000 fewer smokers. Through just really a few policies, which cost really very little, and actually through the tobacco taxes generated more money for government programs than they spent. And we've tried to use some of those principles for dealing with what I would consider to be our next biggest behavioral problems, and that having to do with diet and physical activity. Overall, we've seen great improvements in health during the last 10 years. And I can't say for sure that it's related to our declines in smoking, but our life expectancy in New York City is now 3 years greater than it was 10 years ago. So a 3-year improvement in 10 years is a lot, and the rate of change is far greater than the US as a whole.
Now, New York has tackled the physical activity challenge, how to create a city that fosters the ability to be physically active in ways that you could think were also trying to be sustainable, which addresses what the World Health Organization has been challenging us to do, create the win-wins of every intervention. New York has taken on the challenge of decreasing carbon emissions by 30%. Can you describe the approaches that under your leadership and in collaboration with the rest of city government, New York has taken to increase physical activity?
Yeah, so I can't take a lot of credit for this, but I do think that there's a lot of great things that are happening in New York City on this that can be used around the world. We know that that exercise as a separate act is difficult for people to do. There's a limit to how much people are going to do that, even though there's enormous health benefits to it. We also know that New Yorkers actually get more physical activity than people across the rest of the country by far, but they actually exercise less, and that's because they're getting physical activity in the form of transportation. And so we've tried to do everything we can to make it so that active transportation is encouraged, that physical activity is built into the things we have to do all the time. Now, we already started pretty well in that, and we have a subway system that makes it easy to get around, and it's actually pretty hard to get around by car here with the traffic, but we've tried to encourage that. At the same time, the city put together a sustainability plan called Plan YC, which started out really thinking about how we're going to deal with the housing of hundreds of thousands of additional New Yorkers that will tend to be in this city over the next decades. How can we deal with that in a situation where we don't want to be burning more fossil fuels? So there is now a sustainability plan called Plan YC that encourages active transportation, less dependence upon automobiles and other machines for transportation. So that's going to help the environment and physical activity as well. Here at the Health Department, we came up with things that are called active design guidelines. These are guidelines for architects and urban planners and engineers when they build anything from a building to a neighborhood to a street that'll make it sort of natural for people to be physically active as they occupy that space.
Some estimates globally are that 50% of all cities will be, through natural regeneration as well as de novo construction, be rebuilt in the next 30 years, 50% of cities. The approach you're taking while you're not building a new city is very much aligned with anticipating the planfulness that could lead to health being built into every approach. How much do you think the way New York has gone about this is replicable or generalizable or valuable in cities in other countries of the world, particularly low and middle income countries?
Well, certainly the idea of how do you build a building or neighborhood in ways that make it so that people are naturally going to be physically active as they go through that space, those are universal. And our active design guidelines have been downloaded, they're free on the web, been downloaded by people all over the world. And so there's already a start right there. Getting back to the other topic, Smoking policies are the simplest and easiest way to prolong life and create a healthier society in a world where the infectious diseases are going away. And those ideas are being adopted around the world. Smoke-free air acts, cigarette taxes, use of mass media. Those are pretty simple, and they're tried and true and been successful wherever they've been put in place.
So sitting outside of the government, one might imagine that if you're trying to create a healthy environment, that the issues of the air we breathe and the paths we walk and the opportunities to maybe rent bikes to get from place A to place B can be led perhaps by government, but have to be intersectoral in both the design and the solutions and perhaps opportunities. Is that correct?
Yeah, absolutely. So you mentioned biking. So New York City is just about ready to start up a bike share for those of you who are live in the city. And that's, I hope we have some people who signed up for it here. I love the concept of the bike share, okay, because it gives people yet another way to get around the city in a way that promotes physical activity, doesn't cause air pollution, reduces injury rates. We're not the first city to do this by far. Other parts of North America have done it earlier, but we're getting in there. And this was done with the sponsorship of a business. Citicorp is the lead sponsor. They're going to be called City Bikes. And so this was clearly in a case where they saw it in their interest to support this something which is really good for the environment and good for health.
So what aspects of creating the health of the workers in the corporations, all represented in this amazing group, has to be created at the level of the city? And what's the central role of government, or the critical role of government in that? And what is the role the corporations need to play as partners?
So we certainly have a shared interest in workers being healthy. And there are things that can take place in a workplace to do that. My feeling is that employers should, at a minimum, have the workplace be a place that promotes healthy behavior. You can't control the behavior of employees, but it means that there ought to be healthy food there, it ought to be smoke-free, it ought to be the stairways are open so people can choose to take the stairs rather than being stuck in the elevator. That's going to help, but recognize that most of the behavior is going to take place outside of the workplace. And so if businesses want their employees to be healthy, they have an interest in there being healthy environments elsewhere. So we feel like it's our responsibility to try to create healthy environments outside of the workplace, but then to work with businesses to encourage them to have healthy environments inside. So for example, we've come up with workplace food guidelines, totally voluntary, which we've now just fairly recently mailed out to a large number of major employers in New York City. So if they want to create a healthy food environment, if you like that term, and they don't have the time to think through what that actually means, the standards are right there, and that means that the vendors who are supplying the vending machines or cafeterias can be told, okay, well, just give me the New York City standards. And by us creating a standard, it's simpler for everyone to take advantage of.
One of the models that you have really engaged in and that New York City over the last 10 years has really pioneered is having a health department, a Department of Health and Mental Hygiene, really identify the opportunities for creating health, where the greatest return on investment would be in creating health, and then partnering with many, many sectors, even within city government, to bring that to pass. For example, here is a group deeply concerned about child survival and child health. If children survive the diarrheal diseases and the malaria, then they are threatened, for example, with an obesity pandemic in the world, even coexisting with malnutrition. New York has tackled that through collaborations with the Department of Education, as well as many other parts of city government. How has that worked?
It's worked well. We're fortunate in New York City government. Not all governments are like this, where the health department is taken pretty seriously. I haven't worked in governments in there are other parts of the country. Often the health department is kind of the low rung of the totem pole and not considered as important as economic development or the police, or whatever. So we can bring together other city agencies and do things, for example, where we have food procurement guidelines for city government that says if you are any city agency that is purchasing, serving, offering food for people, then it has to be healthy. And here are the guidelines that come up by the health department to do that. and that applies to schools, but it goes way beyond schools. I think we estimated, I forget how many millions of meals per year the New York City government buys, but it's a major market player. So that has benefits within government, it has benefits that spill over beyond that. Let me just mention one other thing, particularly around businesses. We've also partnered with other health departments around the country, health organizations, and with business around some health initiatives. One of them is the National Salt Reduction Initiative. Despite what you may have thought you read in the New York Times yesterday, there is widespread consensus that modest reductions of our sodium consumption would have a huge benefit in reducing hypertension and the complications that go along with that, heart disease and stroke. And that we'll all be a lot healthier if we simply reduced somewhat the amount of sodium in the food that we buy. And so we're working with some 30 different health departments and health organizations around the country, and with good chunks of the food industry to, in a coordinated way, gradually reduce some of the sodium levels. And it's a long-term process. We haven't changed the world yet, but we're absolutely making progress. And major food companies have really stepped up to that, and it's worked really well.
There are some estimates, both domestically and globally, that about 60 to 70% of health is created through public health. Another 20 to 30% through the medical care that matches people's needs. If you take a public health lens and think about a city, what do we need to do a better job on across sectors, business and government and not-for-profit academic sides, in terms of setting goals together about how to create population health and who really needs to lead on what? How can we do that?
It's a complicated question, but first let me just reiterate a point you made, and that is when people think about health, they tend to think about healthcare systems, and healthcare systems are extremely important. We all want to have great healthcare systems, but they don't drive health outcomes nearly as much as everything that happens outside the healthcare system. Things that influence whether we smoke, how much physical activity we get, whether we're infected with HIV. And those are things which society as a whole has influence on, and that public health is the one that can be in a position to identify the problem and say, here's what we need to do to solve it. Now, here in New York City, we've come up with the strategic plan of sorts that's called Take Care New York. It's got 10 items that said these are the 10 things that we as a society can do, we as a city can do to promote health that will have the greatest impact on morbidity and mortality. There's a lot of things that all sorts of different organizations can do to participate in that, but it's simply articulating that is a good percentage of the solution right there, so that everyone knows, oh, okay, well, if I, as not a health expert, if I want to have an impact on health, here's where I can contribute. So it's an open plan, and we try to, as much as possible, have everybody sort of recognize it and sign into that.
So Tom, we have one question from the audience,
Okay.
which actually there may be, no, one, which I'd like to tell you, and then I think we're going to wrap up.
Okay.
Thank you. The question is, urban communities are heavily impacted by tuberculosis. Mm-hmm. Have we learned the lessons from the drug-resistant TB epidemic in New York in the late 80s?
We have learned the lessons in that, and there are important lessons there. The tuberculosis is something that cannot be solved without a good public health system. The tuberculosis control program in this country were left to atrophy because people thought it was a problem of the past. And when alarm bells were rung, when we saw great increases in rates in TB, there was funding to put in, and programs were rebuilt. They were extremely well managed. And I actually wrote an article at the peak of all this saying that TB was uncontrollable in the AIDS epidemic, that we were not going to be able to solve this problem. I was proven wrong, and proven that really it's just a question of good management of TB control programs. It's a categorical program, it's very narrow in its focus, but if everybody who's identified, everybody who has TB gets identified quickly, put on treatment, given directly observed therapy, if their contacts are identified and put on treatment, you can make this problem go away. It is absolutely solvable, and the costs are there, but they're small in the big picture.
So public health is our collective investment in the well-being of all of us. It's a wise investment, and unified with the issues of creating cities of the future as the context that creates health seems to be a great investment. Tom, thank you very much. Thank you to all of you.
Thank you.
Thank you.